Hi friends, I'm Dr. Molly Brinkman. I'm a small animal veterinarian near Nashville, Tennessee, and this is a show for people who love their pets, like to laugh, and realize that life is hard, but dogs and cats help. I love veterinary medicine. I'm probably already obsessed with your pet, and I want you to understand more about both of those things. So welcome to the Dr. Molly Says podcast. Hello, friends. What is up? I don't know if you see my scrubs. They are the new drop from Figs, which when you listen to this or if you're watching this, they dropped yesterday. So they're coming out tomorrow and they're so fun. They have, you can't see it. Look, they have Spider-Man, sparkly Spider-Man face on the back of them and then the Marvel tag on the front. They're so cute. And I got them in this red color and blue, and we took some really fun Spider-Man pictures in them. So anyway, new Figs drop. You heard it here. Not first, but they're really cute. I went to Jamaica last week. So if you listened to the episode last week, it was short. We had just like a little chat about the clinic and the local vets and everything going on there. So there was some really great feedback about those clips on social media. Some people just had a lot to say about Veg Veterinary Emergency Group from one of the clips where I said that Veg's open concept was kind of one of my inspirations for the way we laid out the clinic. So I just feel the need to clarify a little bit because some people are like, that sounds terrible. So Veg, an emergency group, if you missed it, they have a completely open concept emergency room structure. So all their clinics are big open rooms that are ERs. Our clinic is not going to be one big open room. I think that works actually pretty well for ER, but in a GP setting like our practice, that's really not possible. So it's not one big open room. Everybody's not going to be looking at each other the way I've laid everything out, which will be easier to see when we have more footage of it all done. I've tried to make it so that our clients can see and observe what we're doing and what our job looks like and how we're taking care of their animals, but also having some very healthy separation for everyone involved when it comes to like treatment and surgery and hospitalized patients. So anyway, stay tuned. If you want to see what that looks like, we'll have more and more footage of what the clinic looks like on the inside. And then one day, very soon, when we get everything completely done, we'll have lots of like virtual tours of what everything looks like. So I'm excited for you all to see it, and I'm excited for it to just be open and actually just do the dang thing and see if my crazy ideas work. So we're going to do a fun episode today. We're going to do another dog breed because you all had a lot of fun with the dachshund episode. So today is the day that we're going to talk about my good friend, Sophia the Yorkie. If you're new here or you don't follow me on social media, what are you doing with your life? Dr. Molly Says is where I make my own content. And I do this thing where I act really silly online and I have all these dog breed characters that I do. So like if this dog breed, I do a Labrador a lot. If a lab was a person, what would they be doing in this situation? So one of my recurring characters is Sophia the Yorkie. Let me tell you about Sophia. I've thought about interviewing Sophia on the podcast. If you're listening, you should let me know what you think about that. Sophia is a Yorkie. We're going to talk about Yorkies today. And Sophia is a very pampered lady. She has a handler, assistant. She's an assistant named Susan. Nobody knows if Susan is her owner or just like someone who's been hired to help her. But Sophia is not always kind to Susan. She bosses her around. Sophia always has a bow in her hair. I probably should have worn a bow today. And she's very particular about what she likes. The girl knows what she wants and what she doesn't want. And I can appreciate that about her. But no, the people love Sophia the Yorkie. And so in honor of Sophia, we're going to talk about the Yorkshire Terrier. Actually, I think people from Yorkshire have like a very specific British accent that I cannot do, but we're going to get into it. All right, let's talk about the Yorkie. So if we're talking about a dog show, Yorkies would be considered in the toy group of dogs. If you don't know what a Yorkie is, they're very cute little creatures. They're small dogs, usually like under 10 pounds, 7-ish pounds. They can range in size. Show standard though, my understanding is like under 7 pounds. And they have very kind of like fine, longer, almost human-like hair rather than like a thick fur coat, which we'll talk about what that means for someone who thinks they might want to have a Yorkie. So they are, because of their coat, I would say they have, or we know they have like less shedding than say like Cooper, my Labrador Retriever, who molts regularly. So less shedding than a lot of dogs, but they do shed some, and they are definitely not a low maintenance coated dog. So we'll get into that a little bit more. Let's talk about the history of the Yorkshire Terrier as a breed. It's one of my favorites. If you don't know this about the Yorkie, they were not created for royalty. A lot of like lap dogs that we think about, like Cavaliers, were made to like be a queen's little dog and sit in their lap. Not the Yorkie. So the Yorkies were developed during the Industrial Revolution in Northern England. Scottish textile workers brought these small little cute terrier dogs south into Yorkshire. How do they say it? I don't know. Some of my British friends are going to laugh at me for that. So they crossed these little terrier dogs, the Scots did, with local terriers in Yorkshire, and they were creating rat hunters. That's right. Yorkies were made to be murderers. Rat murderers specifically. So they are mousers. So they were bred to be really good at hunting and finding and killing rats and mice. Because in textile mills and coal mines, they needed help controlling the vermin, the rats and mice and things like that. So that's what they were developed for. And then later on, Victorian society did fall in love with them because they are very cute and they can grow a very like luxurious, long, silky kind of coat, as you may have seen if you know any Yorkies. So they basically went from blue collar pest control to fancy Victorian royal lapdogs. So here we are. But we know, or if you know dogs, they still very much are little terriers who can have prey drive and definitely have a lot of personality. And so it's one of my favorite things about them. All right, so let's talk about the breed standard. So there's a Yorkshire Terrier breed club, of course. So breed standard is, or the AKC breed standard would be less than 7 pounds. No actual standard for their height. They describe them as fine-boned but sturdy with a square, well-proportioned body. I do like a stocky little Yorkie, I have to say. Like I love when somebody comes in and I see them for the first time. It's like this little boy Yorkie, and he's just like, he's very square and well-proportioned body. Kind of marches in there. Where's the rat? I love those. Okay, so their coat will grow long, straight, silky hair. It grows continuously like human hair. And the breed standard of a Yorkie is that they have the blue body, so like dark body, blackish, with a rich golden tan. I'm reading this so I don't get it wrong. On the head, chest, and legs. Puppies are born very black and tan, and then their black coating can lighten up, which creates that like blue silver color, which you often will see. And I just love these breed standard descriptions. Their movement should be proud, confident, and athletic with a level top line. And their temperament is standard should be courageous, alert, intelligent, and self-assured. I mean, they are usually confident. I will definitely give them that. But that's what I mean. Like a confident little boy Yorkie marches in my exam room. He's like, "What's up, lady?" I love a Yorkie. So you might be thinking, I have definitely seen like teacup Yorkies that have different coloring. They stay really dark or they have kind of more brown. Teacup Yorkies, micro Yorkies, pocket, these are not recognized varieties of the breed. So anytime we deviate from like a breed standard from a kennel club, a lot of people get concerned about breeding practices. Is that actually what's best for the breed to make them as tiny as possible? but you will see them. So there are breeders who will breed them to be even smaller. So you can see a range in sizes and some of like what their coat pattern and whether they turn blue or not. I think a lot of people do think about Yorkies as these like delicate little dog that maybe pops out of somebody's Louboutin purse. But they really are very kind of spunky, stubborn, can be hilarious little dogs with a lot of personality. So they definitely often get very attached to their owners. They are smart dogs. They can be quite bold and confident, opinionated, absolutely. And I would say surprisingly athletic is a possibility. So, I mean, my in-laws had a Yorkie, Sadie, and I mean, she was a little one. She could go, they can run really fast and jump and do all kinds of things like that because, again, they were bred with the intention of using them for mousing and hunting rats. So they had to be very fast and quick on their feet. So they're built for that. They often think they're much bigger than they actually are. Lots of Yorkies would go toe to toe with like a giant Cane Corso. And they probably would scare the Cane Corso. I would say a lot of Yorkies probably would love to go on adventures. They definitely are not usually super quiet dogs. I would say they're pretty vocal. Lots of Yorkies are, barkers, yap yap dogs, as some people might say. And that's probably just because they probably want to be like a little watchdog. They're looking out for the rats. So yeah, they're usually not, or they're not always, they weren't intended to be these like fragile little dogs. They have a lot to say about it. And they probably would all enjoy exercise, some scent training, agility work. They're terriers. They're giving terrier. I love a terrier. I'm going to have a terrier eventually. I just have to say, if it were not for my husband, I would have like 12 dogs, maybe more, and goats and a miniature pony in my backyard in suburban Tennessee. Okay, let's get into the grooming, because if you're thinking about getting a Yorkie, hear me now, it is not easy to keep their grooming up. So they have these coats with very fine hair that continuously grows, okay? It can get matted and tangled very easily, and it can get very long very fast. So they have to have very consistent routine grooming. They have to be brushed daily if you want them to have a long coat. If you want them to stay short, which I personally love a short-coated Yorkie, you just have to keep them cut short a lot. So you might be looking at grooming appointments once a month for some of those. And then they can need a lot of regular medical care as well, but like nail trims, ear cleaning, things like that. A lot of them are going to require regular care for those things. The short haircut is called a puppy cut. Like I said, kind of my favorite if you have a Yorkie, but you do have to take them to maintain that a lot. I would say if you want to get a Yorkie, yes, they're happy to like hang with you, but I think mentally they will do a lot better if they get some type of exercise, mental stimulation. So walking, enrichment. Walking is not exercise. This is one of my things I harp on. A walk is not exercise, but it is mental enrichment. It's good for them to get outside, look around, interact with the world. It's good for them. But exercise and play, also very, very good for them. Puzzle toys are a great idea for any terrier, Yorkshires included. Working with a trainer if you're going to get a Yorkie. Some people think like this is not what I would expect, but it's reality. So they're smart and they want to do something with their brain, so you can help them with that. And if they don't have a lot of mental stimulation and exercise and things like that, it can definitely lead to more behavioral problems where they might that's probably why a lot of Yorkies are barking in people's house all day, because they're just not getting the activity and like mental exercise that they need. So let's talk about nutrition. One of my favorite things to talk about at all, but Yorkies are little dogs, right? So they're tiny little dogs, and it's important that they stay at a healthy weight, just like any dog. And because they're so little and they're puppies, they're teeny tiny. So we do see Yorkie puppies who will get hypoglycemia. So when they're puppies, if they're not eating often enough, their blood sugar can get low. It's harder for their little tiny body to regulate that. So I do see Yorkie puppies with low blood sugar come in and they're like real dumpy. They get some sugar and then they feel a lot better. So it's just something to be aware of. It's very important to try to keep them lean. They definitely are little dogs that can become obese. A lot of people just don't realize, especially if they're feeding kibble. A little bit of kibble goes a long way, especially in a really little dog. Kibble is very calorically dense food. And so, a 5-pound Yorkie probably, depending on the kibble, if we're talking about kibble, needs definitely probably less than a cup of food a day. And for some people, that's like hard for them to wrap their mind around. But just obesity is one thing to be very aware of, and we want to prevent that. And so something else is, I will tell you that I know from experience, Yorkies are very good at being very demanding about getting a treat. And a lot of sweet, precious, elderly people end up having Yorkies as pets. And let me tell you, those Yorkies have them trained, and they will just, my grandmother-in-law has one, Dixie. Graham has Dixie, and that dog has her so trained. I mean, she just will sit there and bark at her until she gives her something, and she's picky. She doesn't want pot roast. She wants, or no, maybe she does want pot roast, but they're picky, and so they convince a lot of people to help them be obese. So we want to try to prevent that. So Yorkies are fun. They are hilarious little dogs. They have a lot of personality. They're definitely, I wouldn't say, they're not super low maintenance. I would say they're medium maintenance. When we talk about small dogs, I would say they're a little bit more maintenance needed than a lot of other small dog breeds. But I love them. They're really great dogs, but they have personality. They can be stubborn, but they are often really, really sweet dogs and clearly like precious and cute and very endearing personalities. But they all have a little bit of Sophia in them, so you might end up being Susan. Yorkies, like a lot of small breed dogs, do have quite the list of possible medical problems. So I was going to kind of walk you through what all of those things look for. These are important things. We're going to talk about like buying a Yorkie from a breeder, but these are things to think about when you're thinking about picking a breeder if you're going to buy one from a breeder. There are Yorkie specific rescues out there, and we do see Yorkie mix type dogs a lot in shelters and rescue situations. So you can find a great little Yorkie kind of dog, not just from a breeder. So let's talk about the problems that they may have. Dental disease. So lots of very small breed dogs have just a proclivity for periodontal disease. They get tartar buildup, they get inflamed gums, they get infection under the gum line. They have very small mouths, they can have crowded teeth, and this is a problem. So it's really important if you have a Yorkie or if you are getting a Yorkie to be very diligent about dental care, oral hygiene, oral health. So we want to start brushing their teeth day one. Get a Yorkie puppy, start brushing their teeth day one. Brush their teeth every day if you can. Yorkie puppies will do something where they retain their deciduous teeth. So their baby teeth are supposed to fall out while the adult teeth grow in. But a lot of Yorkies will hang on to especially their upper canine baby teeth. So if you look, they'll have like double-decker canine teeth up here. And so we often have to go take out those baby canine teeth when we spay or neuter them. Tooth loss, periodontal disease, tooth fractures, all of these are common things that happen. So brushing their teeth regularly from as soon as you get them is really, really important. You want to have a veterinarian who's always looking at their mouth, talking to you about, okay, here's when I think we're going to need to do our first oral assessment under anesthesia and cleaning. For a lot of Yorkies, that's going to need to happen by the age of 2, if not sooner. So just be prepared for that. It's why pet insurance that has dental plans can be a really good idea for a dog like that. An orthopedic issue a lot of Yorkies deal with are luxating patellas. I need to do an episode about this, but it's a condition where usually it's because the groove that holds their kneecap in place is too shallow. And so that kneecap little bone will pop in and out of that, this area that holds like this groove of bone that holds the patella. And so their kneecap basically slips in and out. And sometimes when it's out, that feels weird to them. It feels like they can't like do their knee right. And so you'll see them a lot of times they'll like hold one back leg up while they run, and then it'll just suddenly be comfortable again. So they put it back down. So it's a pretty common thing we see in Yorkies and a lot of small breed dogs. We grade luxating patellas, and depending on the grade kind of determines, and if the dog is painful or uncomfortable or having arthritis, determines whether or not we need to do something about it, like surgery. But it's definitely something Yorkies have. Another really big one for Yorkies is tracheal collapse. Probably should do an episode on tracheal collapse, but collapsing trachea is a condition where the actual tissue of the trachea is not the way it's supposed to be. The structure is not good. And so over time, some of the soft tissue in their trachea starts to get into their airway when they are breathing or drinking or eating sometimes, and it makes them cough. And so they can have this kind of persistent hacking or like goose honky cough. When they get excited, they can cough. When they drink, they can cough. If you pull on their leash, it can kind of induce a cough. And so collapsing trachea is not something we can necessarily prevent really, other than breeding properly or treat the actual collapse of the trachea. But we can manage the irritation and the coughing to try to keep it at bay. But collapsing trachea is eventually often a very terrible disease because they just get so abnormal that it's hard for them to breathe just normally ever. And so we do end up sometimes euthanizing those dogs because of just severely collapsing trachea. But the good news is in like more recent years, we've kind of developed some better ways to manage it. And I think education about it is getting better. And so it's getting a little bit better, but collapsing trachea is a big thing that we see. Another disease, interesting disease that I should also do an episode on, that Yorkies are prone to is they're like a classic breed for liver shunts. So portosystemic shunts are a congenital liver condition. So they're born with abnormal, basically blood flow through their liver. Yeah, I need to do an episode. These dogs often will see, they can develop neurologic signs, especially like after they eat. They can have seizures or neurologic weirdness. They can have poor growth. A lot of times we don't see very obvious clinical signs at first, but then they start to get elevated liver values. They can kind of have some other vague symptoms, but basically anything like that in a Yorkie, we're thinking, oh, does this Yorkie have a shunt? So liver shunts are a big deal. Some of them can be cured with surgery. It's not a cheap surgery to do liver surgery, but it can be cured. Another cool, but not bueno disease that Yorkies are kind of known for is so the technical name is aseptic necrosis of the femoral head. So the casual name is called Legg-Calve-Perthes disease, or Perthes, some people say. So this is an orthopedic disease that happens where the femur, the head of the femur, so the upper leg bone where it connects to the hip, for one reason, doesn't get good blood flow, especially during like development. And they get degeneration of the head of the femur. So like the ball of the femur that goes into their hip socket, basically. And they'll just become lame, painful, usually when they're young. And these dogs and Yorkies are just kind of also poster children for it. And the surgery we do to fix it is called a femoral head ostectomy, where we just cut off that femoral head that's not behaving the way it should. And that usually fixes them. The good thing about Yorkies and having this disease is that they're tiny. And so they usually do just fine. Their hip joints figure it out. They do just fine without their femoral heads. But it is something we always think about if we have a young Yorkie who's just limping on a back leg and we don't really have a reason why. Always something we want to check for. We're going to take x-rays and we can usually see evidence of that on an x-ray. Okay, pancreatitis. We've talked about pancreatitis because Yorkies are these little dogs. They are a breed that is a little bit more prone to pancreatitis than your average dog. They also definitely, as they age, are more prone than some breeds to things like degenerative heart disease, so valvular disease, mitral valve disease, pretty common in these dogs. So they often will develop heart murmurs as they age, and that's usually secondary to valve issues. again, it's usually slowly developing mitral valve disease that we can often manage for a very long time with medications. We just want to check for it. Anytime we hear a heart murmur in a Yorkie, we're going to say, depending on where it is, this is probably a mitral valve problem, but we would need to do some imaging to figure it out and make a good plan for them. They also can develop cataracts as they age, like a lot of small dogs, any dogs, but a little bit more prone to that. And we do see a lot of Yorkies with dry eye, so this kind of autoimmune condition where they don't produce enough tears. And so that's something we can see in Yorkies as they get middle age or a little bit older. But again, something we can manage with medications. That was a lot. Those are a lot of things. It kind of makes them sound like medical disasters. A lot of those things are manageable things. Some of them are fixable things. This is why breeding programs and ethical breeding is so important, because Yorkies can have a lot of these problems. And so breeding for ones that have less of those problems is really, really important. So as far as like someone who's thinking about getting a Yorkie, if you have kids and you're like, is this a good family dog? I think they can make great family dogs. My experience is that a lot of Yorkies don't like love a little kid, like they're not into it. I'm not saying they're going to be mean to them, but I also don't think they're going to be like wanting to cuddle with them when they're 2 or 3 years old. And so, if you have little kids and you're getting a Yorkie, I think it's great for them to be puppies and be used to them already. But if you're bringing kids into a Yorkie's life or an adult Yorkie into kids' life, they might be a little wary of them, but they often will come around and you just want to, be aware of the signs that they're not comfortable. But I think they can be great family dogs. I think they can be really well-behaved dogs. I think they probably need a little bit of training for that just because they are terriers. They can make a great dog for retirees, apartment dwellers, but also I think Yorkies would probably make a great farm dog. I would love nothing more than to drive around in a truck doing, like if I was a horse vet again or a cow vet again, and have me a truck dog that's a Yorkie. I think they'd make a great truck dog. So they're quite versatile little things, and a lot of them are happy to sort of be your lap dog, but they also have it in them to, do fun, cool things outside or wherever. So if you couldn't tell, I personally really like Yorkies. I think they're a great little breed. I'm glad that they exist, and I'm glad to have a lot of patients that are Yorkies or Yorkie mixes. A lot of people, breed Yorkies with other breeds, and that's a whole nother conversation. But any little dog with Yorkie in it, I usually do like. So if you're thinking about buying a Yorkie from a breeder, just some things to think about besides all the important things I always talk about. Patellas are something that they can look at with the parents and more lineage behind them. Eye testing, cardiac evaluation. You definitely want to talk to a breeder who has familial history. Have any dogs in this line had liver shunts? Because we would definitely want to breed dogs that don't have that in their history, not just the parents. And then our normal breeder things to look for. You want to be able to see where they are. It shouldn't be super easy to get puppies. Wait lists are a good thing with breeders. They should be asking you a lot of questions. AKC paperwork is not the end all be all. That does not tell you that that's a good ethical breeder. And they should just have a lot of testing done on their dogs. They shouldn't be churning out a bunch of different litters. They shouldn't be making a bunch of different kinds of dogs. So these are just normal things to look for. I actually made a post about breeders, looking for good breeders, on my page today. So a couple days ago when you're listening to this. So if you want to check that out, it's a carousel post on my wall. So that's the down low on Sophia the Yorkie. She loves a bow, but I'm telling you, she could be a farm girl too. Okay. If you have questions about Yorkies, let me know. If you're listening, you can watch this on YouTube. And if you're watching on YouTube, you can listen anywhere you listen to a podcast. Make sure you're following Dr. Molly Says Pod to see clips of our next episodes and me, Dr. Molly Says. And if you're not following the local vets, we have an Instagram page if you want to follow along with the clinic journey. And I will see you next week on the Dr. Molly Says podcast.